Thank you so much for your company. So why are we slipping through these global rankings?
Yeah, good morning, guys. So I think the positive news, probably to start with, is the fact that the UK itself has improved over the last 70 years. So most countries across the world now have seen improvements in kind of life expectancy, mainly due to the improving healthcare systems across the world. People are living more healthier lifestyles. But what we are seeing is some countries have gone up the rankings more than what we've got in the UK. So if you take, for example, some of the Scandinavian countries, we do know that the treatment and the diagnosis for things like cancer, whilst that's improved in the United Kingdom over the last 70 years as well, it's gone much better in countries like in Scandinavia. So we do know, for example, if somebody is diagnosed with cancer, they seem to be finding it earlier in those countries and they treat it better when you're looking at their healthcare system. So, and another key factor that why there's such variation across the country as well, and why some say the UK figures haven't gone up as much of some countries, is that we've got some large health inequalities even within the United Kingdom itself. So latest figures from the Office for National Statistics show that if you're looking in England and you look at men, that men who are living in the poorest parts of England die 10 years younger than those in the most affluent areas of England. And a lot of that, again, will be due to lifestyle, but also access to healthcare. Some of the most affluent will be able to access some kind of a private healthcare. And the pandemic, I think, will actually see that kind of worsening, which is a bit of a concern, I think.
Yeah, I'm going to say it's interesting, and I don't know, it'd be interesting to break down how much of it is down to things like treatment, cancer treatment and things, or just the different standards of living and the different lifestyles, different diets that some of these Scandinavian countries have. I mean, we know they have sort of a very different lifestyle to us, actually, and so is that the key factor here?
Well, yeah, you only got to look at the figures even within just the UK itself, Stephen, that the fact that you've got that big 10-year gap between people in the poorest areas and the most affluent areas. That will be a factor of the lifestyles. We do know, in the UK, we tend to have some unhealthy diets in some instances, lots of more alcohol consumption. If you go to places like Norway, the cost of alcohol is quite significantly higher than places like the United Kingdom. But I think ultimately, there's a mixture of a lot of different things and factors at play here. In particular, say, access to healthcare when you're looking within the United Kingdom, and then we do know that the NHS, whilst we've obviously got a health system which is free for all, it doesn't perform as well as some comparable health systems across the world. And I think this isn't a new story when you're talking about things like cancer survival. People have been calling on improvements for that, for many, many years.
Very interesting as well, the geographical picture even in this country, and there's a difference, isn't there, in life expectancy depending on where you live in the UK?
Yeah, and unhealthy life expectancy is just as an important metric, really, because where you're looking at when you're looking at healthy life expectancy, it's not the average age that somebody would die. It's looking at the average age of where somebody would be in good health to actually have a reasonable life. And when I worked at the Office for National Statistics, I was looking at these figures myself and publishing them. And you can even go on the tube line from somewhere like Richmond, and you on that district line in London, and you go from Richmond, which is kind of an affluent area, you go across to some of the poorer areas, and huge inequalities just on one railway line within London that you get. And I think the big concern for me now is the pandemic has worsened things. We've seen all these excess deaths over the pandemic, which will have an impact on the life expectancy figures, but also you're looking at those large health waiting lists, and people who are richer will be able to pay to go private, and people who are poorer will be just stuck on those long waiting lists. So we could see that gap widening over the next 5 to 10 years as the government tries to tackle this huge waiting list that we've got.